Hello, viewers. Today I want to talk about how to communicate with patients. This is part of an AETCOM lecture that I recently delivered. So I wanted to keep a document on my YouTube channel after I had delivered this lecture just for future reference and also for the benefit of people who are not able to attend this lecture. Although my advice always is please attend the lectures live and not check them out on YouTube. In fact, I believe most of my students aren't even aware of the fact that I have a YouTube page. With that out of the way, the topic of the lecture was communication skills, how to demonstrate patience, respectful behavior, non threatening behavior, non judgmental behavior, and empathy while communicating with patients. In this particular lecture, I first talked about the various scenarios in which a doctor or a medical student might have to communicate with patients. Then I described how one could demonstrate patience, respect, non threatening behavior, non judgmental behavior, and empathy while communicating with the patient. So, one of the common scenarios when medical students or doctors have to communicate with patients is while obtaining history. Also, during clinical examination, when one has to explain the test they're about to perform and then perform the test. Explanation of the test findings or why you're asking a particular question or what the investigation results are showing, what it means for the patient, what kind of treatment the patient uh, needs to be on, how many times they need to take a medicine, if there a particular way in which they should take a medicine, all that needs to be explained to the patient. And especially if there is bad news, then you need to be extra patient with the patient and explain what it means and how you're going to go about it in trying to combat the disease along with the patient. And in cases of surgery, of course, you need to obtain informed consent after explaining the disease, explaining the relevant anatomy, explaining the steps of the surgery, the possible benefits that you aim to provide by performing the surgery, the potential risks and complications of the surgery, the alternatives to surgery, if any, and the post-operative instructions that the patient has to follow, the precautions after the surgery that the patient needs to follow. All that has been explained. All that has to be explained to the patient. Now, when it comes to guidelines for communication, broadly speaking, you should always use clear language, simple language, and accurate language. You can't think that you want to keep the language simple, so you'll compromise with the accuracy. Cancer remains cancer, but you have to talk about it in a simple and clear manner so the patient easily understands what you're saying. And while you are treating a patient, you should always provide timely information, timely updates, and you should not keep the patient in the dark regarding whether they are improving or deteriorating. And while communicating with the patient, you should always give the patient opportunities to ask you questions. It should not be a monologue, it should be a dialogue. The patient should be able to ask questions wherever they feel like it. And sometimes patients are reluctant to ask questions. Sometimes they feel that there is a power imbalance because the doctor possesses so much knowledge and the patient possesses no knowledge about that. They might feel disinclined to ask questions, considering that maybe a question that they ask will be met with a hostile response, a less than ideal response, or even derision because it might be really stupid. Remember that while communicating with the patient, it is your duty as a doctor to ensure that every question can be asked and the patient feels comfortable asking questions. And those questions may not be completely logical, but they are not logical to you because you have spent your life studying that subject. It might be completely logical for the patient. So you have to patiently hear out the question and give the patient the opportunity to ask those questions. And then you need to answer those questions also. You can't just brush them aside. You can't dismiss those questions. You shouldn't do it. Now, why is communication skill important? Communication skill is important because if you do not communicate well with the patient, then the chances of the patient understanding the gravity of the disease and the importance of following the treatment prescribed will not be impressed upon the patient. The patient will not improve. That is one reason. The other reason is sometimes if you are not communicating properly, then it can lead to aggravation in the patient's mind if they are not recovering and you They might blame you that you were not able to communicate the instructions properly. So that should be your intention, that you communicate everything to the patient in a very clear, simple, and accurate manner, so that the patient can comply with the treatment you have suggested and hopefully improve. Another thing is that there are people who will resort to violence at the workplace, and sometimes it's not a fault of anyone. But even in situations which can turn violent, you need to know how to communicate, because at the end of the day, when you are a medical professional, the only defense you really have, apart from the societal defense and the law and order personnel, the only defense at your disposal is your communication skills. So you need to be very good at your communication skills. So this is a hypothetical scenario that I gave for my students, because of course I'm an ENT specialist, so I talked about an ENT disease. And in this situation with the patient, there is ample opportunity to communicate with the patient in several ways, such as while taking history, while performing clinical examination, while telling the patient what the provisional diagnosis is, while ordering the investigation that is required to arrive at a proper diagnosis, then again explaining the diagnosis and the future treatment plan to the patient, obtaining informed consent for the surgical procedure, and providing timely updates when the patient is admitted to undergo the surgical procedure, and even after undergoing the surgical procedure, before discharge and after discharge, accurately explaining to the patient exactly what precautions they need to observe. Now, the first thing that I wanted to talk about is, while you are talking to the patient, you should demonstrate patience. And one of the most important things is you should not treat by the clock. Now, this is something which is much easier said than done, because there are so many patients waiting outside when you are treating one patient. Usually, it may be a situation where you're treating one patient at a time or one patient in a day. That is certainly not the kind of life a doctor wants to lead. So, in many situations, what happens is doctors have to attend to multiple patients on a single day, and they are acutely aware of the shortage of time, because everybody has 24 hours. But you need, as a doctor, to develop a method to treat every patient as per their clinical need, not as per the time available to you. So for that, you have to understand which patient requires more time, and you also need to grasp that by actively listening to the patient's complaints. If you understand what the patient's complaints are and you have arrived at a diagnosis, usually shortens the time on its own. If you are a very competent doctor, you'll be able to understand how to treat the patient in a short time. But that doesn't mean you should aim to treat a patient or every patient in a short time. Also, every patient will have concerns, and those concerns may be something which may appear extremely banal to you or unexpected to you, but you have to address those concerns. You can't be dismissive about them. When you are asking questions, you should ask them in a very appropriate manner. If you're asking a personal question, you should ask them, you should explain it to them why that question is important to be answered. You should not make them uncomfortable. They should be left under no illusion of the reason why you're asking those questions and how it is directly related to you being able to understand what their diagnosis is, and if you can diagnose their disease correctly, you'll be able to treat them properly. So questions should not only be appropriately asked, but it should be also framed in a manner that the patient can easily answer it in a yes or no fashion in certain situations. Some questions you can ask in an open-ended fashion, where you need the patient to give a long answer. And if you listen to that long answer, suppose you had a list of 20 questions that you were going to ask, and if the patient has given a very coherent long answer to one of your questions, then maybe 10 out of those 20 questions have already been answered. So you're left with 10 more questions instead of 19 more questions. You can only be able to reduce the time if you're listening to the answers provided by the patient actively. Another thing that you should avoid is you never try to treat two or three patients at the same time, answer one question from one patient and then turn to another patient and then give another instruction. That is something which is a recipe for disaster, really. So you should definitely avoid that. You should avoid also being on your phone or doing something else while you're treating the patient. That is something which is also not a good idea. And also, if the patient has a grave disease, you should not give them false hope. For example, if a patient has a very advanced stage of cancer, you should not tell the patient that it is not a serious condition. You should not tell the patient that you have some cure available to it that will definitely cure the disease. You should only tell the patient what is appropriate in terms of the existing guidelines. And you should never tell the patient something which is inaccurate. Next comes demonstrating respect. So when you're treating a patient, you're not just treating the symptoms, you're treating the patient as a whole. So you should treat the patient as a human being, and you should greet the patient as you would greet any other human being. You should introduce yourselves, because as doctors, many of us have this assumption that the patient knows us. That is not the case. You have to introduce yourself, and you preferably should also mention your diagnosis. You should definitely introduce yourself, not diagnosis. You should definitely introduce yourself and mention your designation, especially if you're working in a hospital system where there is a hierarchy of the different doctors. So the patient is left under no illusion regarding who he is talking to or who she is talking to, whether you're a middle grade doctor or a consultant or a junior doctor. You should introduce yourself with the appropriate designation. Then you should confirm the identity of the patient, because you don't want to talk to a patient who is probably not there for you. Maybe they are there for somebody else, some other doctor, and you spend all the time talking to them. So it's not, should not get the patient's identity mixed up. So confirm the identity of the patient first, and then confirm how you should address the patient. For example, I had a friend in medical school who I knew in the first month of medical school as Jeet. And then in the next few weeks, I found out that his name was Jeet Rahman. And in a few more weeks, I found out his name was actually Munshi Jeet Rahman. And towards the end of first year, I understood his name was Shehzada Munshi Jeet Rahman. Now, I had been referring to him as Jeet because everyone else was calling him Jeet. Some people were calling him Munshi, some people were calling him Rahman. But that is something you can do in your friendly cohort. When you're addressing a patient and he has a name as long as the name I mentioned, you should definitely follow it up by asking the patient, "How may I address you, sir?" And then, while you're communicating with the patient, you should always maintain eye contact, because that definitely helps build good rapport. And of course, non-verbal communications are also important. You should not smile inappropriately, or you should smile when the patient wants you to smile. You should express the correct degree of empathy when the patient is sharing something that requires empathy. And as always, you have to address all of the concerns of the patient. It might be something related to their finances, that they would not be able to afford the treatment, or their distance from the hospital, concerns that you logically have no way to remedy, but you still need to address them. You can't be dismissive about them. You can't tell the patient, "Why are you telling me all this? I don't want to hear all this." That's not the way. You should patiently hear the concerns and address them to the best of your ability. You can't really solve every problem, but you have to listen to every problem and try to provide solutions if you know any. Otherwise, you have to explain. See, mostly what happens is the patient says that I live very far away. Then the obvious solution is, if you know a doctor in that area, you can give a suggestion regarding that. Otherwise, mostly, even if you patiently hear out the concerns of the patient and tell them how often you can be available, that addresses most of their concerns. Whenever you're asking a patient a personal question, it's very important to ask it with appropriate degree of sensitivity, especially if it's related to addiction history. You need to be very sensitive about that. You don't want to come across as somebody who is being judgmental, threatening, or disrespectful when you're asking personal questions. Also, while you are performing a test, you should definitely obtain consent before the test, after you have explained the details of the test. It's not a good idea to just mention the name of the test and then ask for consent, because that consent is not valid, because the patient doesn't know what that test entails. So the patient can turn around and say that you didn't tell me that this test meant this. I didn't know. If I had known this was going to entail all this, I would never have allowed you to do it. So you don't want to get into that situation as a doctor or a medical student. So you should explain the test very, very clearly and only then obtain consent to perform the test or even a surgical procedure. And at all times, it is very important to maintain confidentiality of the patient. Now, this can be while you're presenting a case, you should not reveal the name of the patient, or when you are presenting a case for research purposes, you should hide the information of the patient. If you're applying for jobs and you're mentioning the list of surgeries you have performed, you should definitely not divulge patient data that these patients were the patients in which you performed the surgeries. Or if you're preparing a resume, all these things, you should never include patient information in these documents. Even in research publications, only if the patient has expressly granted their permission should you use their pictures which divulge their identity. Otherwise, you should not divulge the identity of the patient under any circumstances, and definitely not on social media to glorify your achievements. That is not acceptable. Now, I understand the compulsion or the enthusiasm people feel when they become doctors to share a picture of them performing a surgery, but just pause for a while and think, what if you were the patient? What if you were the patient and you woke up next day and you saw on the Instagram feed of your treating physician, you under anesthesia, part of your body is cut open, and you are on the Instagram feed of the person who is treating you. You would not like it. So that's why I feel you should never share patient details on social media. Next up, you should always demonstrate non-threatening behavior. One of the most important things is if you find yourself in a stressful situation, such as you need to perform a surgery, which is of an emergency nature, or some procedure which can save the life of the patient, you should stay calm under all circumstances. And you should also never exaggerate the impact of the disease just to convince the patient to undergo a procedure. Whatever is the known impact of a disease, you tell that in a very professional manner, and we'll discuss how to break bad news. But you should not exaggerate the impact of a disease. Also, you should never rush the patient to agree to an examination or treatment. You should not say, I only have 5 minutes, please make up your mind. That's not the right attitude. You have to allow the patient time to decide whether they want to go ahead with a procedure or um, clinical examination or not. Also, if the situation turns violent, such as the patient starts abusing you or gets angry, you should not try to escalate and be as angry as the patient or be more threatening to the patient than the patient is to you. You should try to de escalate. The easy way to de escalate is always talk to the patient in a quiet room, but of course, you should not be the only person in the room. Ideally, the family members of the patient should be there, because even if you're having a perfectly normal conversation with the patient in a quiet room, the patient being alone with you might feel threatened. You should not create a situation where that may happen. Also, if you're in a quiet room with the patient and their family members, you might feel threatened. So you should also have people of your team in the same room. They may be nursing staff or other doctors. And also, a very important thing about de-escalation is you should know where the exit is, and if situation really turns difficult, you should leave the room. Now, how to demonstrate non-judgmental behavior? You should never blame the patient. For example, there are many diseases which are known complications of certain habits. You should never blame the patient that you got this disease because you had this habit. That is not the right way to communicate with the patient. Also, if you're asking personal questions, as I said, you should ask them with the appropriate level of sensitivity. For example, I'm afraid I need to ask you a few questions that might make you feel uncomfortable. However, these are important for me to know in order to get a better understanding of what might be going on in terms of the diagnosis. So, if you allow me, I will ask you those questions. Is that okay? That's how you ask a personal question. Of course, you can change the language, you can make it more concise, but that's the general context in which you should place the question. If the patient is feeling vulnerable, maybe they are a victim of domestic abuse or other non-accidental injuries, you should definitely feel you should definitely make the patient feel supported and definitely guide the patient towards support groups or other specialist employees in the hospital system who provide support to patients. And as always, one of the ways to demonstrate non-judgmental behavior is through non-verbal communication. You should not give any facial expression. You should not demonstrate any facial expression which might suggest that you are judging a patient for anything. Also, if the patient feels extremely vulnerable, especially a cancer patient, and asks questions like, "How long do I have to live?" which you cannot answer with any degree of confidence as a doctor, you should not be dismissive about that question. That is a very serious question which needs to be answered with sensitivity and seriousness. How do you answer that question? So you can answer that question with by relying on the existing literature, but you should also remember to not reduce the lifespan of a patient to 6 months or to a definite period of time. It's important to address the concern first. You should say something like, in your position, I understand you might be feeling, if I were in your position, I would also have asked a similar question, but I'm very afraid I can't give you a very accurate answer. To the best of my knowledge, there are ways in which we can treat this disease, and it would be a better idea to focus on the treatment right now. And the final topic is how to demonstrate empathy. So empathy and sympathy are not the same thing. Empathy is when you're feeling with someone. Sympathy is when you're feeling for someone. For example, somebody loses a job and you have never had a job. You can't feel empathy for that person. It's very difficult. Maybe you're both students and you're talking to your friend, and your friend has not done well in a particular test, academic test. Then you can empathize with your friend, provided you are an empathetic person. Putting yourself in the shoes of the person you're talking to is empathy. Feeling bad for a person is sympathy. How do you deliver bad news? Bad news is delivered through the spikes technique: setting, perception, invitation, knowledge, empathy, and summarize the future treatment plan. Setting should be a quiet room where you're not interrupted, and the patient should have their family members, and you should have members of your medical staff also present in the room. Perception means how understanding how much the patient already knows about the disease. I is for invitation. You should invite the patient to give you the opportunity to tell them what information you have for them, such as, "I have the test results with me. Do you want me to tell you the results right now? Or would you like to schedule another appointment for that?" So you are inviting the patient to give you permission to share the knowledge, which is the K. Now, usually it is bad news that we are talking about here. So you should always deliver bad news in terms of warning shots first. Like, "I'm afraid the report I have here was not what I was hoping for," or "I'm afraid I don't have good news for you." So that gives the patient a few seconds, a few minutes to process the fact that he is about to receive bad news. And it's very important to pause after delivering the warning shot so that the patient processes what you have said and then again tells you, "Please tell me what it is." And then you go ahead and tell them what the bad news is. Now, different people react to bad news in different ways. Some people get angry, some people start crying, some people go silent. Based on their reaction, you have to provide the appropriate level of empathy as the response. And only when the patient has come to terms with the news do you then proceed with telling them a summary of the future treatment plan. You should definitely assure the patient regarding the quality of care they're likely to receive, and you should definitely tell the patient that they'll get opportunities for timely follow-up appointments, that they will not be abandoned during any course of their treatment. Also, if there are support groups available, then you should definitely guide the patient towards those appropriate support groups, because the kind of empathy they are likely to get from people who also have the same disease is something you cannot match or you cannot provide as a doctor who only knows about the disease. But people who have actually lived through the disease, who have fought the disease, and who have recovered from the disease, they can provide much more empathy than you can. So you should guide the patient towards appropriate support groups. For example, Acoustic Neuroma has a very good support group called British Acoustic Neuroma Association. For people with anosmia, there's a very good support group called Fifth Sense. People with cancer in the UK, there is a very good support group called the Macmillan Group. So these groups are important, and I hope you like this video on AETCOM, Attitude, Ethics, and Communication. Communication skills is perhaps the superpower that doctors need and deserve. Bye-bye, take care, and don't forget to be awesome.